I am Dr. Malik. Today we will talk about what is the food for children, what is the best ideal food for children, what is the best food for children. There is a concept that healthy parents will have healthy children. Healthy parents will have healthy children. So before giving birth to a child, before conceiving or before giving birth to a child, the female, the mother and the father should be healthy. The mother and father should be healthy. That means there must be an ideal weight. Height and weight should be ideally related. Particularly the female, particularly the mother. Father is also important, but father's health is also very important, but mother is more important. 70% goes to the mother. Her weight should be very much under the normal guidelines. For example, her waist by hip ratio, she has to measure her circumference at umbilicus, that is hip, that is waist, and again hip around the buttocks. So it should be waist by hip ratio should not be more than 0.8, should not be more than 0.8 or 0.85, and weight length in centimeters, height in centimeters minus 105. Height in centimeters minus 105. That should be the average. That should be the weight of the mother. Just before conceiving, and this is the ideal. So health is usually calculated with your weight, your waist, your hip ratio, waist by hip ratio, and your weight according to the height. So weight is calculated as height in centimeters minus 105. For example, you are 170 centimeters height, and minus 105 is 65 kgs. Minus 105 is 170 centimeters height minus your minus 105, that is 65 is your weight. You can understand. Height in centimeters minus 105 is female's weight. So please calculate this. So if a healthy mother will give birth to a healthy fetus, and one more thing is the body mass index. The body mass index should be between 18 and 23. The body mass index should be between 18 and 23. Above 23 it becomes obese. Below 18 you are underweight. And above 23 you are definitely overweight. So between 18 and 23 you have to maintain your body mass index. This is briefly to give birth to a healthy child. This is at the time of conceiving. This is giving birth to a healthy child. So this is usual, because if you are overweight, if you are very usually nowadays we are getting very out of 10 mothers who are coming for delivery, nearly 7 mothers are very much overweight and obese, and they are giving birth to hefty children, that is overweight children, and these children are going to get fatty liver by the time they are 17 or 18. And they are the people who are landing in all the problems of metabolic syndrome, that is, you all know, infertility, etc., PCOD. These are the children who are going for it. Please take care of this. And now we will go to the food for children. What is the ideal food? We all know up to 6 months of age, mother's milk is the only food. Up to 6 months of age, it is mother's milk is the only thing. So after 6 months, we are going to substitute our food. So many people feed them with Cerelac, etc. So mainly till now we are feeding them with wheat, rice, sugar, maida, and jaggery. Jaggery is from sugarcane. So these are the usual things that are being used till now. That is wheat, rice, sugar, maida, jaggery. Jaggery from sugarcane. This is how Usually we are feeding the children. All these things have high glycemic index. All these foods, they have got very high glycemic index, and the children are becoming obese. Children are becoming obese. Childhood obesity has gone to very high level, and these are the people who are going for fatty liver and other complications, like all metabolic syndrome complications like PCOD in females, and you can understand their infertility, they are landing in infertility and so many health problems. They are developing diabetes at very young age, and multiple complications of obesity and all. So try to avoid these foods. Try to avoid these foods which has got high glycemic index. What is glycemic index? High glycemic index. See, the glycemic index is divided like 70, above 70 to 100 high glycemic index, 55 to 69 moderate glycemic index, below 55 low glycemic index. Glycemic index means the time food takes, the time, whatever, suppose you are eating rice, it gets converted in your small intestine into glucose very fast. For example, you are taking a spoon of sugar, it gets converted very fast in the mouth itself, it gets converted, and in the small intestine it completely gets converted within no time into glucose. The more speed the food is getting converted to glucose, the glycemic index is more. That means, for example, your rice, your wheat, your sugar, your maida, your jaggery from sugarcane, these are all having high glycemic index. That means they can get converted into glucose very, very, very fast. Very, very, very fast. This is what we are not supposed to eat. We should eat only the foods which have got low glycemic index, below 55. For example, millets, pulses, and salads, buttermilk, curd, okay, you can have non-veg, eggs, and ghee, particularly very good quality ghee, and oils. It is better you take homemade or village made oils. Don't take this in the shops, don't purchase those oils which are coming from factories. Take village made oils, please, because in the shops half of the oil is mineral oil, please. So oils, fiber rich fruits, fruits which have got low glycemic index. For example, if you eat watermelon, low glycemic index, high glycemic index. So high glycemic index, the foods which get converted into glucose very fast. For example, in fruits, you have watermelon, you have pineapple, you have grapes. These are the foods which get converted into glucose very fast. They have got high glycemic index. Try to take less. You can take less glycemic index fruits with more fiber. For example, guava, you can take sitafal, you can take more, something like that. All these things, low glycemic index. Mango also has medium range. Mango has some 55 to 60. Mango is medium range. Please just see the glycemic index before you eat. If the glycemic index is low, if the fiber is more and glycemic index naturally will be low, because fiber foods, they get converted slowly into glucose. Please see that. So glycemic index, if the glycemic index of any food is more, try to avoid that, and try to take foods which have got low glycemic index. So everybody advises nowadays to feed the children not with high glycemic index foods. Please try to shift to millets. Please try that too. This is unpolished millets, and millets as a whole, the grain as a whole. Don't make it to flour and all. Millet as a whole. Again, if you make it into flour, the glycemic index increases. So take the millets as the grains, take grains. The whole grain is the best food. Whole grain is the best food. And as far as the fruits are concerned, as the fruits are, don't take juices. Don't take juices. Only take the fruit as a whole. Take the fruit as a whole. This is what we say. And how can you avoid obesity, fatty liver, increase the immunity, and reduce the metabolic syndrome? See, by using all these things, by using millets, pulses, and salads, buttermilk, curd, non-veg, eggs. See, regarding the non-veg and eggs, regarding the chicken and eggs, we have some problem with them because nowadays the poultry industry, they are using a lot of steroids, lot of hormones. So be aware of the poultry industry. It can harm you. Chicken and eggs, they can harm you because of the poultry industry contamination. So be cautious. So by just if the child is fed with these things, low glycemic index foods like millets, pulses, salads, buttermilk, and ghee, oil, that too village made oils, and fiber rich fruits. If you are feeding the child with these foods, naturally there is no chance of, you can avoid obesity. The child will not become obese, fatty liver will not occur, and the immunity of the child will be very good, and that metabolic syndrome complications, the child will not land. The child will never land in metabolic syndrome complications. One more problem here is even hereditary diseases. Some diseases are hereditary, and some people are having muscular dystrophies, etc., in the family. By giving foods like this, low glycemic foods, millets, pulses, all these foods, avoiding wheat, rice, sugar, maida, jaggery from sugarcane, please try to avoid. You can have jaggery from palm tree. Which has got low glycemic index, that can be taken. See, by using this low glycemic index foods, fiber rich diets, definitely you can modify your definitely food is the thing. What food you are giving to the cell, whatever food you are giving to the body, it goes into the cell, and definitely it has got a modification factor. The genetic diseases, so-called genetic diseases like muscular dystrophy, so many things, they also have. There are instances they have shown either they come late or they get modified. They can modify it. Even there is a modification of the genetic diseases. Please try to see this. If you are giving good food to the child, definitely the health of the child will be good. Not only routine diseases, some hereditary diseases which are coming can be postponed or modified. They occur later or they occur in a less degree of seriousness. Please try to understand. The food is most important to the child. From the childhood, after 6 months of age, after mother's milk, try to change the diet into low glycemic index foods, fiber rich products, fiber rich diet. These are all the things I wanted to tell you. Most important, and the parents at the time of conceiving the child must be healthy. They should not be overweight. They should not be unfit. They should be fit. They should have correct weight, or take some time. Take 6 months, take 1 year to come back to normal size, and then conceive. A healthy parent will have a healthy child. That's the concept. And one more thing is 80:20 ratio should be followed. 80% is your diet, 20% is exercise. 80% is your diet and 20% is exercise. Whatever, wherever, is the same formula. So to the child also it applies. So please let them play for 45 minutes, and play should be like normal, like what we were playing in our childhood. Please let them play for 45 minutes freely with the other children. 45 minutes per day, any child should play. So that comes under exercise. 80% is the diet and 20% is exercise. That is there. Send them to the playground, let them play for 45 minutes. This is what